everyone, and today we are going to have a conversation with Dr. Eskild Petersen, who is an infectious disease doctor, professor. He chairs the European Society of Clinical Microbiology and Infectious Diseases Emerging Infectious Task Force out of Basel, Switzerland. Something, right? You do. That's a
Yeah.
long word. And he's editor in chief of the International Journal of Infectious Diseases. These are just to name a few things that he does. Um, but thank you, Dr. Petersen, for being here. Uh,
Thank you for having me.
yeah, early morning. At least it's early morning here, but it's still a pleasure to see you again. And we're going to talk about the Hantavirus and the cruise ship because that's all everybody's talking about. And we're going to try to bring some clarity to the situation. Um, this appears to be the first documented hantavirus outbreak on a cruise ship, right? We're familiar with cruise ship outbreaks, but not this one. This is new. Um, so let's just talk about uh, what do you think the risk is to the average person? I mean, I think that's what everybody kind of wants to know. They're reading about this, they're scared. What are your thoughts?
I think it's absolutely zero. Yeah. I can give you a little bit of a background. I mean, there's more than 60 types of hantavirus all over the world. And this specific type of hantavirus that they have in Argentina gives pneumonia. And we have known that for over 30 years. So this is not a new virus. It's not like Corona, who was a completely new virus.
Mm,
Um, we know that it can give outbreak that spread between people, and the best described outbreak happened in 2018 in Argentina, where you had 34 cases.
right.
And uh, and the reservoir of the hantavirus is rats and mice. And they pass the virus in their urine. The urine is probably on floors of houses or caves or whatever. And when you are walking, you're creating dust, and you inhale the dust and you get infected.
Mm,
So when we look at what happened on the cruise ship, it's quite clear that this Dutch married couple who had been bird watching in Argentina and I think other countries, they were already infected, or at least the husband was infected when they
right.
boarded the ship. And then he got very ill and died 11 days after the ship left Argentina. And his wife was, of course, infected because she had been taking care of him, I guess. And he has been coughing out plenty of virus, and she is sitting in a small cabin for a very long time. So, of course, she get infected. She has a very high risk. And, and and then she is leaving the ship on, I think it was the 24th of April, when
Hmm.
there was about 30 people who left the ship, and she is flying to Johannesburg. And when she arrived in Johannesburg, she is so sick that the crew at the KLM Airlines say, well, you cannot fly.
Right.
And then probably there was an air hostess from KLM who got infected, but that's not a surprise either, because you have this very sick person sitting in the airplane, and the maybe the air hostess is bending over her, so they are in close contact.
You know,
Every
I just
other
read, I think she tested negative.
Yeah, but that's great if she tested, if she had symptoms and she tested negative, then she didn't get it. But if you are completely healthy and test negative, it doesn't say anything. But you have to have symptoms before you excrete so many virus that a test will be positive. So all these people who have been exposed but are
Yeah.
feeling great, they will test negative. So you should test people who are having symptoms. But in any
Right.
case, what I'm coming to is that every other person who has either suspected or proven hantavirus here, they were infected on the ship.
Right.
And especially if the air hostess was not infected, and then everybody who developed hantavirus, you can all chase it back to the
The ship.
2 weeks on the ship before people knew what was going on here.
Yeah.
So one of the difficult things with this virus is that the incubation period is 6 weeks. So actually, it can go up to 6 weeks from you are infected until you develop symptoms. And therefore, we can expect that there will be new cases in the next 2 or 3 weeks,
Yeah.
a few new cases. And that is why everybody who has been on the ship, they are being asked to self-isolate at home. There's no reason to put them in the hospital because they are not ill.
Hmm.
They most probably they have not been infected. But if you self-isolate at home and you take your temperature morning and the evening, you will rapidly pick up that something is wrong, and then you are in contact with the health authorities, and they pull you in rapidly and do the testing. So that is what is going on now, is
Okay.
chasing all these
People.
travelers and in their different countries. And if you look at the CNN this morning, I think there was 30 different countries who has received passengers. Another thing
So,
that's important also to realize is that of the remaining 150 passengers on the ship, nobody has been ill for the last 3 or 4 days.
right.
So it seems that all those who got infected, they got infected in the middle of April before people realized that we have a communicable disease on board.
Right. So let's go back to talk about the Andes strain. And you sent me the paper about the Andes hantavirus outbreak that occurred in Argentina between late 2018 and early 2019. As you mentioned,
Yeah,
the outbreak ultimately involved 34 confirmed infections and 11 deaths, which is a high case fatality rate.
yeah, yeah,
And what made it especially important from a public health standpoint was that investigators documented person to person transmission after the virus was initially introduced from rodents into the human population.
yeah.
And the paper described how transmission appeared to accelerate through close social interactions and crowded gatherings, but then slowed significantly after isolation and contact tracing measures were implemented. So, my questions for you is what lessons from that earlier outbreak do you think are most relevant today?
Well, I think the transmission in the 2018-19 outbreak took place indoor and at social events. So this shows that you have people close together
Yeah.
indoor. And that's also what we learned with COVID. And I hate to say it, but cruise ships are perfect places for spreading infectious diseases. You have many people in a very confined place, and they probably all eat together 3 times a day. So you I don't know if you remember, but in the beginning of the COVID pandemic, we had this Diamond Princess cruise ship, and I don't know, it was 1/3 of the passengers and crew who got infected. It
Oh,
was really a mess. So I would say that it's not the virus that's special; it's the circumstances. This is a
mm,
perfect environment for creating an outbreak like this one. Then people will say, but can you be sure that you do not have a mutated virus that are
right.
spreading more easily? And then the answer is, of course, you cannot be sure about that. It's an RNA virus, and they mutate more rapidly than DNA viruses. But our colleagues in South Africa who admitted one of the patients, they are sequencing the virus. So we probably know that within the next 4 days. But I would be surprised. I think it's the circumstances here. It's not the virus. So everything starts with one or two of the Dutchmen who come on infected, and probably only one of them, and
Right.
then it spreads from there, and then it stopped now. We will see cases, but if they can all be linked back to exposure in the middle of April, then we know there's no secondary cases, and that's why I said that the risk of a pandemic to the general population is zero, because
Zero.
yeah, because you of course.
You're not even
if
saying low,
you
you're saying zero.
no, but listen here.
Okay.
If your husband was on the ship and then he flies back home and he said, I don't
I'm
trust
leaving.
the
Okay.
authorities, so I'm not telling anyone that I've been on this ship. And then he gets ill and he is not telling the people in the household that he has
Okay.
been exposed here. Then
Yep.
there will be a risk of a few secondary cases. But that's not the general population, because it's somebody who had contact to somebody who was at the
Right.
ship.
Right.
So I think this is I mean, this is completely different from corona.
Yes, yes, and that's a wonderful point to make for people to hear. I want to go back to that outbreak in Argentina because
Yeah,
you sent me the paper. I read it, and and it talked about super spreaders, basically, people who had high viral loads and
yeah.
extensive contact, as you mentioned, with in indoor spaces, mass social gatherings. But one thing I found interesting in that paper was that the age of the person, the severity of disease, or the stay, how long they stayed in the hospital, didn't seem to matter for transmission. So is does hantavirus does age not matter like as much? We saw obviously in COVID, which people remember, age mattered significantly. So I'm just curious, do you have any thoughts on that?
Well, I think that in every kind of infectious disease where you have no immunity, then age matter. And you can also see the Dutch couple, one was
Yeah,
69 and one was 70. The German lady who died, I don't have her age. But in the Argentinian outbreak, it also depends on what was the age group frequenting these social activities. Why
mm,
was it young people going out for a dance or middle-aged people going for a beer? So that the age range that get infected depends on what kind of people went to this social place.
makes
I,
sense.
I, I got one question about that paper, and that was one patient in Argentina was infected just by passing the index case in a corridor. So there was a very brief encounter between the infected person and the person who got infected. But but then you can say, yeah, but that was only 1 out of 30. So what I'm saying is that it's not impossible to get infected from a brief encounter, but it's definitely not what normally happens. Normally, you need quite a massive exposure,
Okay.
like the wife of the Dutch
Right.
man there. But it's not impossible.
Yeah. No, that's definitely cause for concern. That's weird. Definitely weird.
Yeah, yeah,
Um,
yeah.
so let's talk about these words, close contact. Sometimes you hear public health officials say prolonged close contact. And I'm in public health, and I can tell you from the work I do, the more you talk to people, nobody has any idea what you mean when you say close contact, right? It's just like, do you mean sitting next to someone on an airplane for 3 hours, or do you mean like snuggling with someone in a bed? And then what ends up happening is everybody just avoids everybody, right? Because nobody really knows what close contact means. Like your version of close contact might not be my version. So I'm just curious, like,
Yeah, well, actually, I just think it's common sense, because if you are
you
infected with,
overestimate common sense.
I'm European.
Okay, fair, fair. But you know what I mean? It can
No,
create
what
panic.
I'm saying is that if you are infected and you are coughing out millions of virus, then these virus will dilute in the air. So there will be fewer virus a meter from you, and even fewer 2 meters. And then if the wind is blowing, as we had in COVID, we had this choir who had been singing, and somebody got infected standing 8 meters away. So you just have to try to make space, and whether it's 1 meter, 2 meter, 3 meter. I mean, it's a matter of probability. You will
Yeah,
just decrease the probability that you will be infected if you have a little bit more distance
right.
than if you are very close. And I don't think there's any absolute meters. Our government also said, well, 1 meter, 2 meter, 1.5 meter,
Sounds like
and
Beetlejuice,
that
right? Yeah.
changed, and we had
6 feet.
to, and they put mark on the floor in the supermarkets that you had to stand there,
Yeah,
and
we
so
have
on.
that.
But I mean, it is really common sense that if you, I think the most important thing is that if you have somebody close to you, somebody you know who is appearing sick and coughing, put a surgical mask on them, because then you will keep the virus inside the surgical mask. So,
Yeah,
so they do not excrete a lot of virus in the environment. They will still get a few out, but it will really decrease the
right.
viral load. Another thing is that the risk outdoor is almost zero because the virus will be very quickly diluted by the wind and so on. So, for instance, we had no restrictions on outdoor
Right.
being outdoor during COVID,
Yeah.
and I think it makes sense. The risk is indoor.
Indoor. But
And that's
this,
also what we see on the cruise ship, of course.
right, cruise ships, and but then you had people get off before they knew what was going on because they're just living their lives, and then they get on planes, which are
Yeah,
still close contact, and then they
yeah.
go home. So,
But
like, what?
I was reading. I think it was the UK public health authorities this morning, and they have a focus on the plane that took most of the passengers from the ship to Johannesburg from St. Helena. And what they were saying is that they identified the passengers and those who were sitting 3 rows in front of 3 rows behind the Dutch lady, they will be advised to self-isolate. And that is based on what you know of the spread of infections in airplanes from previous. So there is a risk, of course there is. The interesting thing here is, should this have been handled differently? Don't forget that the ship had a doctor on board, and
Yeah,
I'm not sure he realized that he had an infectious disease. If he realized it, did he get good advice? I don't know when they started to implement quarantine on the ship to tell people to stay in their cabins and not eat together in the dining room and so on. But it is don't forget that when this ship anchored at St. Helena, nobody knew what it was,
right.
and I know from friends in South Africa that what they were thinking in the beginning was that it was bird flu. And the
Really?
second, yeah, because these people had been bird watching.
Oh,
The
bird
Dutch
watching.
couple had been
Duh.
bird watching.
Okay.
And you have bird flu in Argentina in sea mammals. So they were thinking this is a serious
Yeah.
pneumonia. It's bird flu. The second thought was Legionnaire's disease. Legionnaire's disease.
Oh, Legionnaires. Sorry.
It's
Okay.
Legionnaires. Yeah,
Yeah.
yeah. And then they surprisingly found this hantavirus, and it's amazing that they found it because nobody was thinking about it.
Right.
But I
That.
mean, it's a really a scary situation, and if the doctor on board, who is probably not an infectious disease specialist, if he do not get good advice, then the quarantine rules come in too late, and you have a
Mm,
spread. And I think that's what we're seeing now. It's people who were infected in the middle of July before we got the test results from the South
yeah.
Africans.
I mean, and that's the thing. In hindsight, it's always 2020, like, but you should always do like an after action review after an outbreak response to see. But like the doctor on board, I'm wondering like, so like, let's say the guy had a fever, he's coughing, like you're on a cruise ship. What do
Yeah.
you, what do you do?
No, what you should do is, I mean, this is a Dutch cruise ship, so he should contact the public health authority in the Netherlands. You have an excellent public health institution, RIVM, in the Netherlands, and ask for advice. And
Okay.
that's what you have to do. If I mean, the most important thing, if you, in everything we are doing in life, is to realize when you are running short of knowledge, and then you
Mm.
have to ask somebody. And they are backup. I mean, the public health authorities in the Netherlands would, of course, immediately start thinking, here we have a respiratory illness that are spreading, and it's not a trivial one because we have one dead person.
Right. Yeah, that's true. I I think but then you think about people on the cruise ship who just want to have fun and they're like, oh, come on, like some people will take it more seriously than others. And who wants to be locked in their cabin on a cruise ship, right? So that's the other thing. There's the human factor of outbreak
Yeah,
response.
yeah, absolutely.
So,
But
like,
I mean, the captain on a cruise ship has absolute authority.
so
So
never get on a cruise ship is what you're saying. No.
neither have I, and I won't.
I've never been on a cruise. Um,
No,
I,
neither have I.
I don't have a desire, but
No, no, no.
it hasn't increased after this, that's for sure. Okay, let's talk about the rodents. So when someone hears rodents, it comes from rodents. You're thinking of mice and rats. But like these are wild. Like mice and rats. I think they said the long-tailed rice rat. Is that right? It's
Me,
like a tongue
I
tongue
don't know.
twister. Well, okay, but if you Google the rat, I like to look at rats. Like my dad's a veterinarian, and I'm always fascinated by people bringing their rodents. They're cute, but like he has a really long tail, this guy. But I just want to be clear for people, like it's not their house mice, rats, and guinea pigs that they're
No.
gonna right. And the reason I'm pointing out because sometimes you see like people will take their guinea pigs to the pounds after something like this, and it's not your pets at home. These are wild guys. Yeah. Okay.
And
Just
no,
have to
no,
say.
no. This is animals in the wild,
Yeah.
outdoors, and but of course, if you have empty houses or if you have caves, especially caves
Yeah.
where which is very dry, and you are walking into a cave, you will create a dust.
The dust.
Interesting, there's been an increase in cases of hantavirus pulmonary syndrome in Argentina over the past year. So they have recorded 101 cases in humans, and there's a speculation that climate change may change the rodent population, so you actually get more rodents and perhaps closer to human habitats and so on. But of course that is quite speculative. But there is an increase in these hantavirus cases in Argentina.
Hmm. Okay. That's good to know. So we're dealing with the aftermath of the COVID pandemic. And anytime anyone hears anything about a new outbreak, they're triggered, rightly so. They get worried, like, are we going to have to go in lockdown again? So can you tell our listeners, uh, does this behave anything like COVID and the flu? Like in your professional expert opinion, do people have anything to worry about in that sense?
No, I don't think so. I think this is a virus we know very well. And as the Argentinian outbreak illustrated, you can see outbreaks, but they are very limited, 34 people compared to the millions we had in COVID or when we had the flu pandemic in 2009. And that is because the virus probably has difficulty in going into our cells. So they need something to stick on our cell surface. And if that is the case, then it's probably maybe 1% or 5% of encounters with the virus where it successfully established itself in the human host. So it's much less infective. we and that makes the whole difference. It
Yeah.
makes really yeah. So of course we can always speculate, and human fantasy has no borders, but I
Well,
think it's the circumstances here, this cruise ship, and not the virus that created this outbreak. But we'll see what the South Africans come up with when they have sequenced the virus. That may change it, but I would be surprised.
how long will that take?
Well,
I
with
know you're
the
not there,
modern
but
machines, it should take a few days,
okay.
but so maybe we'll have these data next week. I definitely hope so.
Okay.
I
Okay.
can ask my friends in South Africa.
Yeah, let's do that. We want to get the intel to the people.
Yeah,
So you talked about the long incubation period. I think you said
yeah,
6 weeks. I read somewhere like up to 2 months. It's a long time.
yeah, yeah,
It's a long time.
yeah.
So
But I think 8 weeks is.
still too
I
long?
read it once, but I think that the UK and South African authorities say that you have to self-isolate in 45 days. That's also 7 weeks or 6.5 weeks.
So how long do
So
these souls from the cruise ship have to be, in quarantined? And what about their contacts? You know what I mean? Like how long are they going to have to be kind of careful? What are your thoughts on that?
well, that I think that's a $1 million question, and I would say that if you were a passenger on the cruise ship, then you would probably have to self-isolate at home for at least 40 days, checking your temperature morning and evening. If you were on one of these flights, especially the flight from St. Helena to Johannesburg, where you had this very ill Dutch lady probably spreading many virus in the airplane, you would probably do the same.
Mm,
But if the KLM stewardess tested negative, as you said, I haven't seen that. Then there's no reason to have any precautions for passengers on that flight. Then you have the other 30 passengers who went to many different countries, who left the plane, left the ship, and they cannot transmit the virus if they have no symptoms.
okay.
So even if you were infected on the flight from St. Helena to Joburg, and then you continue on a flight to Melbourne, if you are healthy the whole way to Melbourne, there's no risk to your fellow travelers. But you were on that high risk flight from St. Helena to Joburg, and that means that you could be in the incubation period. So perhaps you should self-isolate because you were on a high risk flight. That flight from St. Helena to Joburg is a high risk situation because you have somebody there probably being a super spreader.
Uh, it would have been so much easier if everyone just stayed on the ship.
Yeah, but I mean,
No, I'm not. It's just a
it was not a
comment.
nice situation. You had the dead husband. His wife was very ill.
Yeah.
I don't know this German lady who died, who is still on the ship. I don't know if they put her in the fridge next to the groceries or how they do it.
God. Okay. Well,
So
Godspeed.
I definitely think that there was not a very nice spirit on the ship
Yeah.
when they embarked with, because common sense told them that something was going on here. We better get off.
Right. Right. And for people at home, or what sort of symptoms would show up early? It's just kind of like
Well,
flu
I
stuff,
think fever. So, and
fever.
then you will get general body pain or muscle pain and severe headache. But but uh,
Mm.
but fever, I would, if somebody asked me, I would say take your temperature morning and evening.
Okay,
But
that's good
if you
advice.
start getting generalized body pain like you do in influenza or severe headache or something, then you should really have a checkup, because then it could be the beginning.
Okay. People hear high case fatality rate, or they hear a lot of deaths. I mean, and everyone confuses, a lot of people confuse case fatality rate with mortality rate, but just case fatality rate, we're talking about people who were diagnosed and then the number of those people who
Yeah,
were diagnosed who died. It's high.
yeah,
It's high for this virus. And
yeah.
that's scary when you hear that high case fatality rate. It is scary. Despite everything else, you're like, geez,
No,
if I get
that
this,
no, but I mean the hantavirus here is in a family of virus we call hemorrhagic fevers, and that include Ebola. So the way you are handling a patient who has serious hantavirus infection is the same protocol as you do with
Really?
Ebola, and that means you correct acid base disturbances, plenty of fluid, perhaps ventilator treatment. It's the same protocol, because what is happening is
Wow.
that these viruses, they attack your blood vessels, so the water in your blood is seeping out into the tissue, so you are losing fluid. And if you don't correct that, then you will not have sufficient oxygen to your body, and then your pH go down, and that's not survivable. So you need a good intensive care unit who know what they are doing. I mean, this is how it is. It's really a difficult situation, because sometimes you have to give people 12, 15 liters of intravenous fluid in 24 hours, and you cannot handle that unless you have very experienced people in an intensive care unit.
Wow. Now, when you were on my Causes or Cures podcast and we were talking about bird flu, you kept emphasizing get them early, treat them early, treat them early. Like it makes a huge difference. Is that is the same case here or no, not really?
I think that if you can see that the patient who was admitted in intensive care in Johannesburg is recovering, and that's probably because he received treatment at an early stage before he had a multi-organ failure. Once you have multi-organ failure, it's really very, very difficult to reverse it. So if you can give fluid resuscitation early, so you prevent early organ failure like kidney failure or liver failure and so on, then it's much better. So again, early admission is really key to pull these patients through, because there's no antiviral drug, so you have no specific antibiotic you can use.
So it's just supportive care.
Yeah,
Yeah.
yeah,
Geez.
but that is also life saving.
Oh, yes, yes, for sure. It's just there's no magic bullet. There's no drug designed
No,
for
no,
the
no, no,
hantavirus.
no.
Uh, so you've been in the media, and I'm just curious. Do you think the media coverage is proportionate to the public health risk, or do you think is it a bit hyperbole, or it's like click on
Well,
this, it's gonna scare you?
well, I'm usually dealing with my media here in Denmark, and they are quite reasonable. And what they are doing is that
What are you saying, Dr. Peters?
no, but they have a bunch of experts like me who is not employed by the government, and so we are all being interviewed, and I think it's a good way of doing it, because we also during COVID we actually agreed quite a lot. So people hear the official statements from the government and the Public Health Institute, and then you have some independent so-called experts and basically saying the same thing. So we are, of course, we do have some social media postings about saying that we're all wrong and so on, but it's very much less than it is in the US, and I mean we generally we had a high acceptance rate of the COVID vaccines, over 90% in the population. So no, we are quite fortunate.
Well, we have different media landscape and political
Yeah, you
landscape
do
in
have,
the US.
but I mean,
Takes all kinds.
media has to make money, and if
Yes.
something like this happen, you cannot avoid commenting on it. But what really makes the difference is how do you comment, and and I think that one of the tragic things in the current environment is vaccine hesitancy. I mean, there's this book by Peter Hotez from US, where he is writing a book about anti-science, and he estimated that 200,000 Americans died because they wouldn't take the COVID vaccine. And now we have the big outbreak of measles because people will not take the measles vaccine.
Um,
Yeah, and that is problems, but we cannot sort of go back to the old days before social media.
right. But I think too, uh, you can say a lot of things in public health. You can be super accurate, but if you're not connecting to the person you're talking to on an emotional person level, they're not going to
Yeah.
listen to you. They're not going to trust you. So, like, if you insult them, like if you call them an idiot, like, do you really think they're gonna? If you call them even anti this or anti that, do you think they're gonna listen to you? No. Like, I think you really have to make like meet them where they are, sit down at their kitchen table, have a conversation with them, and so you can kind of understand like why they have the concerns they have. I think like the othering, which sometimes I see well-meaning scientists or well-meaning public health communicators online do. Uh, it you have to you want to connect. You want to like always show people that you care about them, and I think scientists can be very good at communicating accuracy, but when it comes to showing empathy, we might, we could use some work, or sometimes egos get in the way and that kind of thing. But I think we can work on that from just a public health communication
Yeah,
standpoint.
I think the one of the problems that I personally have is that if people do not believe in the data you can generate, and all science is imperfect in some way, and that's why we always try to have more than one study before we really believe in something. But if people
Yeah,
do not even believe in studies and saying, okay, but the COVID studies were done by industry, so it's all fake. And that is, of course, not true. Nobody else had the money to do these clinical trials of the new
yeah,
vaccine. So if we cannot agree that numbers are something we can analyze and we can discuss that the trials are not perfect and so on. But if you simply basically do not trust these data, then it's difficult.
yeah. Well, data, I think you're a doctor, scientist, you trust data. Like data to some person, at home might not mean anything. Well, like they're not even going to look at the data. They're turned off by data. You gotta like take the data and show them, show them, like why that should matter to them. So I just because like if someone showed me a chart and I wasn't in public health, I'd be like, what the heck does that mean? Like, why do I care about that?
Mm,
But like,
mm,
show me how it matters to my real life, like that kind of thing. I think
yeah.
just
But I mean that also why this hantavirus outbreak is so fascinating, because you can imagine a lot of outcomes, but if you really
yeah,
stick to the hard facts, then those who got sick were those who were on the ship 2 weeks in April, and we have not really seen any secondary transmission after that. And that's what I try to say. Look here, this is not going to to give us a new pandemic. Definitely not. But it's the conditions on the ship that's important, and not the virus. That's
not
what
the
I
virus.
think. And let's wait for the sequencing and see what they
Yes.
say.
If the sequencing comes out, we might have to bring you back on. Another.
No, I will ask my friend in South Africa, and when she has some data, I can send them to you.
That's a good. That's good. We want to know for sure.
Yeah.
But thank you, Dr. Peterson. I really appreciate you coming on, and this was great. You cleared some things up for us. I learned some things too, so really appreciate it. And to our listeners, be sure to subscribe to the podcast and also check out the website. Okay, thank you.